evening, everyone, and welcome to Lawmakers. This is the 7th legislative day of the 2010 session. I'm Susan Hoffman.
And I'm Lawson. Coming up on tonight's program, the controversial Hawk system comes one step closer to being abolished. An update from the Water Contingency Task Force on drinking water from Lake Lanier. And a panel of experts recommends fixes for the hole in Medicaid. But first, a bill that House leaders say opens the legislative process to more transparency passes the House Rules Committee. House Speaker David Ralston hopes to deliver on his promise to change House rules to encourage more open debate. This morning, the House Rules Committee approved H.R. 1168. Among other things, it abolishes the Hawk system and prohibits the Rules Committee from rewriting bills in committee. Today's committee passage paves the way for a floor debate. New House Rules Chair Bill Hembry opened today's meeting like this. Take a look.
It's interesting, in my 16 years down here in this process, I've always viewed the Rules Committee as the most prestigious committee in the General Assembly and the most honored committee in the General Assembly. And I want you to know that. And I want to make sure that we do everything that you understand that in the process, and that other members understand the critical role that you play as members. So I invite your perspective on things, your insight, to make this committee work properly, to make sure that we vet the bills properly, to make sure that you and your final decisions are making the decisions to move measures to the floor, and they're done wisely. So I want you to be engaged with me as well as the members here, and most importantly, that we do the right thing for the people of Georgia. And that's a process that's open, debated, and most importantly, in your involvement, because you're all valuable members elected by your constituents. So thank you for your willingness to serve in this extremely important role as a member of the House Rules Committee.
House Minority Leader DeVos Porter commended Chairman Hembry on the changes, but said it was really just a start. Porter wants more equality in the number of committees that Democrats and Republicans serve on. He says that right now most Democrats are only serving on 3 committees, while some Republicans are serving on as many as 6. Porter says that Speaker Ralston has assured him that he will work on it, but it will take some time.
The Senate Natural Resources and Environment Committee met today to consider the latest developments in Georgia's decades-long water dispute with its neighbors Florida and Alabama. Lawmakers Valerie Edwards joins us live from the Capitol with this report. Valerie.
Thank you, Nwandi. Late last week, the tri-state water wars took a turn for the better in our favor when a court overturned a July 2009 decision by a federal court that would have drastically reduced Metro Atlanta's ability to tap into Lake Lanier for its drinking water. In 2009, a U.S. District Court judge said Georgia had no right to take water from Lake Lanier, citing decades of federal regulations. Judge Paul Magnuson gave Georgia until 2012 to resolve its dispute with its neighbors. Then, late last week, a panel of judges in Florida blocked an attempt by Alabama and Florida to dismiss Georgia's appeal of Judge Magnuson's ruling. Attorneys for the state are already claiming this small victory in an otherwise very big war.
That's definitely a positive step. We're very happy to see that. Obviously, we're still continuing aggressively with negotiations with Alabama and Florida. We feel that that's the most effective way to resolve this, but that certainly was a very, very good step for Georgia to have its appeal heard now.
Governor Perdue was very vocal in that he would meet with the governors of Florida and Alabama. He wanted to negotiate.
Right.
Is litigation a last step?
Well, in most of these cases, we weren't the ones filing the lawsuits. So, you have to defend a lawsuit when it's filed. To do otherwise would just be to allow Alabama and Florida to win by default. So, we're not in court by our own choice, but while we're here in court, we will certainly aggressively defend the rights of Georgians.
The cost of doing nothing could mean the very survival of our state. Coca-Cola Atlanta Chairman and CEO John Brock co-chairs the governor's Water Contingency Task Force, which is exploring all options to keep the water flowing.
The ruling truly goes into place in July 2012, and nothing has been done. We estimate that it would impact the Metro Atlanta GDP to the tune of 10 to 15% a year, which is $25 to $30 billion, and that doesn't even take into consideration reduced quality of life or lower real estate values. And I think the point for all Georgians to keep in mind is it's big. the cost of inactivity here is big, and I think the good news, again, is the governor has a plan, and now we've got some recommendations coming out of this task force that the legislative session can consider.
Among the contingency plans the Senate committee heard today, well, we've got further appeals, negotiations with the governor's counterparts in Florida and Alabama, congressional reauthorization to access Lake Lanier's water, and forced water conservation. But all of that takes time and it takes money, both of which Georgia are short of right now. Reporting live for Lawmakers, I'm Valerie Edwards.
All right, thanks so much for that report, Valerie.
Georgia ranks 39th in the U.S. in Medicaid funding, and with the dicey state budget, there'll be little improvement anytime soon. But the Access Healthcare Coalition is pushing lawmakers to do all they can for the 1.7 million Medicaid patients here in Georgia. Earlier today here in our studios, I talked with Bill Moore. He is CEO of Atlanta Medical Center and head of the Access Healthcare Coalition, along with George Israel, who's president and CEO of the Georgia Chamber of Commerce, which, by the way, is an underwriter of this program. I started by asking them, what is the coalition's goal?
Perhaps I should explain Access Health Coalition. It's a coalition of hospitals, physicians, dentists, the business community, and county governments. And we were formed for the purpose of ensuring adequate Medicaid reimbursement to the healthcare providers. In terms of hospitals, adequate Medicaid reimbursement would be paying for the cost of providing care. Unfortunately, right now, Medicaid on average pays about 80 to 85% of just the cost of delivering care. So
and that's in hospitals, or that is doctors as well?
Well, that's for hospitals. It's a little bit harder to define the cost with physicians and dentists, but the hope there is that the funding would be adequate so that physicians and dentists would remain in the program and continue to see Medicaid recipients.
But that's not really happening right now, is it? Where some
Unfortunately,
doctors are having to squelch some of their lists,
yes,
Medicaid
the
lists.
reimbursement, Medicaid is on average about 30% less than Medicare, and some of the physicians just can't survive, or dentists survive on a practice where there's too high a percentage of Medicaid, so they're dropping out of the program, or at least stopping to see any new patients.
Right. Originally, the goal was to have adequate reimbursement by 2011, but that has changed given the climate. So what is the goal now?
The most immediate goal is to stave off reductions in Medicaid reimbursement. You're right. The goal was to, as I mentioned, to try to increase that reimbursement to adequate levels, but we all realize that the state's in a tough economic picture, so we're trying to stave off and avert a further crisis.
Okay. George, how did we get here? Very simply.
Well, it's been brought on by a recession. Recession has created increased unemployment. They're saying 10.3%. It's probably up as high as 17%. That means you add people to the Medicaid rolls, then the state has less money to make their match with the federal. So
let's point out there's roughly
1.7
million Georgians right now on Medicaid.
Georgians. But at one point, there were 35,000 new Medicaid patients that were being added to the rolls. So it's a two-edged sword.
What are the solutions?
Well, we've proposed some immediate solutions. I think you have to look at an immediate and longer term. The Access Healthcare Coalition worked with the governor's office in the fall to propose a premium tax on the CMO, the tax on the CMO's premiums, like all other insurers in Georgia pay. The CMOs are willing to do this, and that would draw down federal matching funds. Roughly, exactly
how many do you know?
Well, roughly 250 million. I've heard ranges from 220 to 270 million dollars.
Real money.
Okay, well, if the whole is, if the gap, as Rhonda Meadows has told us, $600 million, right, that would cover roughly half.
Roughly half. That, and with a couple of suggestions we put on, roughly half, and we're willing to work with the governor's budget writers and staff to try to identify the remaining gaps.
Okay, that's where it really gets interesting. How do we cover the remaining gap?
Well, these are difficult, very difficult challenges. You know, I have to answer that two ways. As a hospital CEO and a private citizen, I would support a tobacco tax, a $1 tobacco tax, but I also serve as chairman of Access Healthcare Coalition, which is a diverse group, and we have not taken a position on that. Okay. But longer term, I think, you know, if we don't look longer term, we'll be back here every year having the same conversation. So, you know, I think that the state needs to look at how they reimburse the CMOs and build in some carrot and stick approach as far as rewarding folks if they can look at a public policy and measure the incidence of diabetes, measure obesity, measure premature births, and provide some incentives for making some real impacts on those costs, because we know those are the things that are contributing. Those are a few of the chronic diseases that contribute to the rising cost, and provide incentive and a reward if you can make an impact, and perhaps penalize if you don't.
If you don't. Obviously, businesses breathing down the necks, because it basically comes back to the businesses in these premium costs.
What happens inside of any provider's office or a hospital is there is a cost shift that occurs where they have no other alternative but to shift the cost that is not covered to paying customers, and that is our employers' employees and their families and people even who may be fortunate enough to have individual coverage. There are other ways that gap can be closed. We estimate conservatively that if they really did a good job long term, are really trying to get a handle on the fraud and abuse in Medicaid, that's probably $100 million, and that's a conservative number. The other thing is pushing more people and covering them under these CMOs, and doing a better job in the CMOs of really managing and identifying that chronic disease and managing it better. There are about 7 diseases that are responsible for about 70% of the cost in health care.
Many of which we can control.
Absolutely.
All
Absolutely.
Right. With that, I have to say thank you to both of you, Bill Moore and George Israel. I appreciate your time.
Thank you.
Thank you.
Mental health advocates are hopeful that the $70 million the governor proposes for the Department of Behavioral Health and Developmental Disabilities will increase state services, but the question remains how to balance the funding between improved hospital services and a pathway back to the community.
Just kind of look across all the populations.
We apologize for that technical difficulty. We'll try to get that package on for you. The governor has appointed a mental health task force to create a strategic plan for the state to provide mental health and developmental disability services.
One House member says that if you furlough your teachers, you shouldn't be able to give your school superintendent a raise. Here is Representative N. Reinders on his bill, House Bill 977.
I have House Bill 977 that I would hope would get support from both sides of the aisle. A simple bill that basically says if you're going to furlough teachers, then you cannot be giving pay raises to school superintendents and administrators. And if you do, you at least have to have a public forum on it in the interest of transparency. We had a good reception on it this morning. I'm going to have it over here and ask for your signatures. Thank you, Mr. Speaker.
In other news, new House Speaker David Ralston is honored by his former Senate colleagues today. The Speaker was actually lured to the Senate chamber this morning thinking he was simply taking part in a ceremony honoring all past members of the Senate. Little did he know his former colleagues wanted to honor him in particular. Senate historian George Hooks did his part in introducing the Speaker, who's made history not once, but twice. And I have to say that it was a beautiful moment in the gallery today, because the Speaker really did not expect this at all. Speaker Ralston wanted to remind his senators after his brief speech that they really needed to work together, because Georgians expected them to work together and really didn't care who got the credit, House or Senate. And Wandy?
Well, we're going to return now to the mental health package. As we mentioned earlier, we do apologize for that technical difficulty. However, mental health advocates are trying to balance that funding equation, looking at the money that the governor is proposing for the Department of Behavioral Health and Developmental Disabilities, trying to figure out how many of those served will remain in the state hospitals and how many can return to their home communities.
The state has been running on empty as far as providing adequate services, and we've been exposed in the newspapers for the plight of mental health patients in our mental institutions. So it's way past time for us to step up to the plate, and I applaud the governor being very clear about having additional dollars for mental health services.
In the 2011 budget, increases will go to technology to improve the accuracy of patient records, Medicaid waivers, and hospital improvements to bring the state into compliance with several federal orders, including the Olmstead Agreement.
That is a 5-year agreement where we have committed to the federal government that each year we will begin moving the patients, the people, developmental disabilities out of the hospitals or out of the institutions into the community where they're better suited and better fit.
Even though the money will allow 300 disabled people to move from hospital care to home environments, those who have never institutionalized their loved ones say they remain at a disadvantage. Rita Young has 2 sons with autism.
For our families who have individuals with developmental disabilities, they're still not going to be able to access those services right now. So while we are encouraged by that news for our families, it's still very difficult because the funding has been frozen right now.
As federal investigators continue to probe the state's psychiatric hospitals for incidents of sexual assault, suicides, and suspicious deaths, the state has stopped admitting patients to the 168-year-old Central State Hospital in Milledgeville, in part because of its age.
They also pointed out other areas of concern in patient care and evaluation, treatment, discharge planning, really the whole gambit. At that point in time, we were very, very close to the Department of Justice ordering at least that building to just be closed. By preemptively stopping admissions to the Powell building, we averted that request by Justice.
Mental health advocates say they have to balance the need for hospital services with the desire to transition patients back into their home communities. And both options require funding.
Just because you have a mental illness doesn't make you dangerous. It doesn't make you unworthy. I mean, just changing that whole profile of who people are is very important. But the money is essential because, you know, you do have to have housing and you do have to have supported employment and you do have to be able to get people out of the hospitals and stabilize them in the community.
And that takes coordination with a lot of different agencies, vocational rehabilitation, Department of Education, corrections, juvenile justice. And that's one of the reasons I think the governor wanted behavioral health multi-agency task force to kind of look across all the populations.
And as was just mentioned, there's going to be a task force that's going to create a strategic plan so that the state can provide mental health and disability services.
I told you just a few minutes ago that the House Speaker, David Ralston, was honored by his former colleagues over in the Senate. I'd like you to take a look.
He is a person that adopted Georgia's original colonial motto as his motto for the speakership and to lead the House of Representatives. Sic vos non vobis, not for themselves, but for others. What a question for all of us to ponder. He is the first person in the history of this rich state since 1733 to move from the state Senate and be elected to the State House of Representatives and the speakership. He is also the first speaker in the history of Georgia to be invited back to the Senate to speak to the Senate from this rostrum.
I leaned over to Chairman Mullis a minute ago and I said, no, if y'all are expecting anything because of this over across the hall, forget it. I tell people a lot of times, and I have for many, many years, I spent 6 of the greatest years in public life here in this body and served with honorable people. And last time I was at this podium was to say goodbye, so it's kind of good to be up here today to say hello again.
Speaker Ralston did go on to remind senators that Georgians, voters, really do expect the House and Senate to work together and really don't care who gets the credit.
7 Democrats did not take any of the furlough days called for by the General Assembly last year, according to an Atlanta Journal-Constitution article. Representatives David Lucas and Ernest Williams said that they opposed the furloughs, while Senators Valencia Say, Robert Brown, Lester Jackson, and Gloria Butler say an oversight prevented them from deducting the pay. Senator Ed Harbison said that he thought the money had already been deducted and is now asking to have 2 days deducted each month until he's caught up. Today, Senate President Pro Tem Tommy Williams commended his colleagues for full participation in the most recently called for furlough days.
I want to thank every senator in this chamber for voluntarily furloughing themselves for the balance of this year, understanding, and the public doesn't always know this, that you make a little over $17,000 a year. I happened to visit the Massachusetts Majority Leader's office some time ago when I was the Majority Leader. He had 6 staffers and made over $80,000 a year. That's not true here. We have a very meager salary, and you have been willing not only to turn money back in, but you voluntarily furloughed yourself when you know other state employees have to do the same thing. Thank you very much for your commitment.
Currently, legislators cannot be forced to give up pay, but House Speaker David Ralston says he expects legislation to pass this year that would make furlough orders mandatory. Well, in honor of our 40th season on the air, it's time for another Lawmakers Flashback. Tonight, more from 1971, a committee hearing on fire ant eradication held in the House chamber. Listen closely for a reference to Department of Agriculture Commissioner Tommy Irvin.
With the committee on how we feel about it. All the people in the gallery here, lots of them here today, that are trying to do something about this terrible pest in Georgia. And if we don't get the appropriation to do this job like we're supposed to be done, like they've outlined here to do, like the USDA man has said we've got to do it, like Mr. Irvin has told us we've got to do it, then we're going to just wind up with this state of being completely ruined by this pest. If we don't stop them now, then they will be stopped. Please help us do something about it. Contact your members of the Appropriation Committee. Get them to support the appropriation for the fire ant eradication program, and I assure you we'll do everything in our power to do something about it. Thank you.
Thank you, Mr. Matthews. I wonder if you wait just a minute and see if there are any questions, please, sir.
Yes, sir.
Does anyone have any questions of Mr. Matthews?
Thank you.
Thank you, sir.
Fire ant eradication was a popular concept in the South in the 1960s and 70s, but political support waned and the chemical Mirex was later banned as a pesticide. This has been a Lawmakers Flashback. And for more Lawmakers Flashbacks, remember to keep watching the 40th season of Lawmakers.
You can only get them here. Firearms are once again the topic of much discussion today as the House Judiciary Non-Civil Subcommittee heard testimony on House Bill 615. That's the legislation that seeks to expand conceal and carry laws in Georgia. Representative Tim Bearden, author of the bill, quickly dove into the most pressing part of the legislation, Section 3, which seeks to allow concealed firearms in public gatherings.
Public gathering is the core of House Bill 615. I would like to see law-abiding citizens with a permit to be able to carry in public buildings in the state. The majority of the other states in the nation allow their citizens the right to carry in public buildings.
Supporters and opponents of the bill spoke in the committee today. Dan Kaufman, president of Georgia Gwinnett College, tells why he believes that weapons should not be allowed on college campuses. And John Monroe of Georgia Carry, on the other hand, says that carrying a firearm on college campuses could make it safer for students.
In my opinion, based on my experiences as a college president and as a combat veteran, weapons should not be allowed on college campuses. I'll make three very simple points. First, the current law serves the people of Georgia well. A second point seems obvious, but it has significant implications for the environment in which students, faculty, and staff interact. Colleges and universities are populated primarily by young adults. They are, by definition, less mature than others. Finally, this will not come as a shock to you, any of you have teenagers. Students have romantic involvements or intense friendships with each other that can be emotionally wrenching, especially when they do not turn out well. Introducing weapons into this potentially volatile environment increases the likelihood that personal disputes that today are marked by verbal agreements or at worst a fistfight could well become tragically violent in a matter of seconds.
With respect, all due respect to Dr. Kaufman, when he said that it just wouldn't happen that an armed student could prevent something like Virginia Tech, it has happened. If you Google Appalachian Law School shooting, you will find many stories about how it happened and how two armed law students subdued an attacker with their guns.
The Judiciary Non-Civil Subcommittee didn't vote on HB 615 today. They will hear more testimony at future meetings. Representative Tim Bearden did say that he is working with several organizations, including police chiefs and sheriffs, to make changes to House Bill 615. As he put it, it will take several meetings before the bill can be voted on.
Two bills seeking to ban cell phone texting while driving were considered today before the House Public Safety and Homeland Security Committee. Representatives Alan Peake and Amos Amerson appeared before the committee and answered questions about House Bills 938 and 944.
Numerous studies are out there to show the detrimental effect of texting while driving has on reaction time, driver focus, and increased risk of accident. I want to give you an example of a couple. University of Utah in 2009, drivers who are texting are 6 times more likely to crash than drivers who are talking on the phone. Clearly, texting is a leading cause of traffic accidents in our country. When someone texts while driving, they not only endanger their own life, but the lives of other innocent drivers and passengers. The bottom line, folks, is that this legislation will save lives. And that's why I'm wholeheartedly supporting it and proud to be here with Chairman Amerson.
By passing the bill, you're putting out there in public for everyone to see. And you're encouraging people to not text while driving. I've talked with members of the Board of Regents, and while they can't take sides in all of this, they said that they would make sure that the students at the various universities were encouraged not to text and drive. 26% of all accidents involved texting. 16% of all fatalities involve texting. That alone should make us more aware and want to eliminate, by whatever means, texting while driving.
This is a public safety issue. There are women and children and men dying every day on our streets because of this hazard on our roadways, and so that's why we're looking forward to supporting it. It's going to a study committee. We look forward to addressing it here next week as well.
Now we're joined by Ricky Bevington. She's got headlines from around the state.
I certainly do. Hey, Ann Lundy, and good evening. Accountability for school administrators is taking center stage in Bibb County. That's where Superintendent Sharon Patterson is under scrutiny. The Georgia Professional Standards Commission was already looking into claims that Patterson failed to report 2 principals for misconduct as required by the state. Now it has been discovered that Patterson did not report another principal who allegedly mismanaged federal funds. Officials with the school system do say that the latest failure to report the principal was an oversight. Small biotech companies across the state could be facing tougher financial times. That's because the Augusta-based Georgia Medical Center Authority could see its budget slashed. The state agency is devoted to helping startup biotech companies turn new medical technology into profits and high-paying jobs. However, Governor Sonny Perdue could see that agency's budget cut by more than $300,000. According to GMCA officials, since 2007, the agency has helped Georgia biotech companies create 38 full-time jobs with average salaries of $75,000 a year. Battery maker Exide Technologies has opened a research lab in Milton, north of Atlanta. The facility will develop lead-acid batteries for the hybrid auto industry. Milton's lab would create 40 science and engineering jobs, and at least 50 jobs are coming to Coffee County. California-based Orcon Products is expanding to Douglas. That is where it will manufacture seaming tape for the aerospace and carpet industries. Hiring is scheduled to begin by the end of February. And there is always more Georgia news at gpb.org. And Wendy.
Thanks so much, Ricky.
Tomorrow on Lawmakers, our leadership series of interviews continues with Senate Democratic Caucus Chair Tim Golden, and it's the end of another legislative week, and that means that it's time to check in with Tom Crawford of the Georgia Report. We'll have those interviews and all the latest from under the Gold Dome. It's tomorrow at 7 p.m. And if you have missed any part of this program, please tune in when Lawmakers repeats tomorrow morning at 5:30 a.m. You can enjoy this show over coffee. Coming up next on GPB, watch David Zelski, Phil Proctor, and Valerie Edwards in Georgia Traveler. Tonight's episode features an historic tour of Georgia. Georgia Travelers next here on GPB.
And of course, that's our program for the 7th legislative day of the 2010 session of the Georgia General Assembly. Want to wish our associate producer, Sammy Jones, a happy birthday. I'm Wendy Lawson.
And I'm Susan Hoffman. Please join us tomorrow night at 7 p.m. for Lawmakers, only on GPB.
Good night.
Good night.
Funding for Lawmakers comes from
the Georgia Chamber of Commerce, the voice of Georgia's business community, over 4,000 members strong, working with lawmakers for over 90 years to make sure that our state remains a place where companies thrive.
And by supporters of Georgia Public Broadcasting. Thank you.
This has been a production of Georgia Public Broadcasting.